My name is Joan Yude. Everything happened so suddenly. I felt as if a huge wind had just thrown me.
So this is a view of Joan's head, and I'm making an injection of X-ray fluid, which looks dark. The end of my tube is right about here, and you can see the artery coming up. This is the main artery called the internal carotid artery. It branches, and this is the main branch that supplies the left side of the brain called the left middle cerebral artery. And right here, it is completely blocked.
Realized very quickly that this is not right because I couldn't move my legs.
And the symptoms of a stroke can be anything from sudden onset of loss of function of an arm or leg, loss of vision, difficulty or inability to speak.
Or all of a sudden, your coordination is off and you cannot walk. That is a trigger for a 911 call.
The next thing I knew, the paramedics had arrived.
It was going to disable her for life if she would even survive it. She was older, and so a stroke like that can be very devastating.
As soon as the patient is brought to the emergency room physician notices the stroke symptoms. They're getting some history that the patient had the start of the symptoms within a treatment time window.
I was able to quickly evaluate her, look at the CT images, which showed this complete blockage.
We immediately knew that she had what we describe as a left MCA syndrome. So a blood clot most likely lodged into the left side of her brain.
She immediately needed to go for something called mechanical thrombectomy, which is a fancy term for removing a blood clot that's blocking that artery. It's very important to get the blood flow back as quickly as possible because you can lose up to 2 million neurons a minute.
Time is brain, and so every minute counts. Everyone knows this, so everyone's working fast and in parallel. So as soon as the CT angiogram is ordered, behind the scenes, Dr. Crothomer is calling the anesthesiologist, calling the technologists in, the nursing team that is all needed to help treat this patient.
They've developed basically what we call a stent on a wire or a stent retriever. And that's basically just like the little stents they put out in the heart artery, but it's attached to a little thin wire. And so that goes out in the brain, in the artery that has the blood clot. We let it slowly open up and grab the clot, and then we pull the wire, and we also use suction, and we get that clot out as fast as we can. After we pulled the blood clot out, we made the same injection in the same artery, and now we can see this tangle of blood vessels filling, and these are the normal arteries that are filling the brain.
Often a lot of high-fiving going on as soon as we see the clot out and we can see the patient's immediate responses.
Kind of similar, I can say this because I've witnessed my wife have a baby, but everything is quiet in the room and there's a bunch of movement going around, but the 1 minute or the 1 second that baby actually makes that scream is a very similar sensation that we get once we see the patient moving and or the clot retrieved.
So it's very exciting to be able to walk into a room after all she's been through in the last 3 days, to review the images, review the test results, review her rehabilitation, and realize that she's made almost 100% recovery, and to be able to tell her that she is no longer needed to be in the hospital.
This patient went from a devastating stroke scale to essentially normal. This is why I'm doing this. This is why I love what I do.
It all happened like a dream, and the care was just so wonderful. The nurses were just terrific.
When you're having a stroke, you want to go to a place that can really take care of you. That means we have physicians here 24/7 who can assess your stroke and determine what care you need, including neurologists from Cedars-Sinai who will beam into the ER and assess you and find out what's going on with your stroke and make a decision to treat you within minutes. We have imaging services here 24/7, CT scans, MRIs, angiographies, whatever we need to find out what's going on with your stroke. And we have coverage all around the clock to make sure that we can take care of you. A pharmacist that can mix TPA, a therapist that could see you. That's very important because you need the whole team to be able to take care of someone having a stroke, and we have those services here.
When I'm on that patio, I can almost see Torrance Memorial Hospital, and that's very reassuring. I will never forget everything that they did for me. And God bless you all and continue with the good work.
including neurologists from Cedars-Sinai who will beam into the ER and assess you and find out what's going on with your stroke and make a decision to treat you within minutes.